Well, good evening to you. My name is Steve Broom and I'm Chief Executive of the Council, and welcome you to this evening's broadcast. I'm joined by Councillor Russ Bowden, the Leader of the Council, and Tara Raj, our Director of Public Health. The format of this session is to a piece of advice from the Leader and from Tara and information, and then we'll move to questions and answers. Those questions have been submitted beforehand and have not been over-filtered, I can assure you, to make sure that people understand the situation regarding COVID as it is now here in Warrington. We are having a significant rise in the number of positive COVID cases within Warrington. We just want to raise that matter with you so you understand the nature of the numbers that we're now facing. There have been 4,000 additional cases in England in the last week, and in Warrington in the last week we had 241 positive cases, and Tara will talk about the implications of that. We also want to mention the advice we offered earlier in the week around not asking households not to mix in one house, households not to mix in one house or in their garden. I also want to talk about the implications of the rule of six. We've had a really positive approach to this, dealing with the pandemic in the last 5 months. The schools, the hospital, the businesses, the care providers, the bus company, the train operators, the leisure sector, all work really hard to try and make sure we have a secure, COVID-secure environment for the whole of the town. But very, very sadly, we've had this spike in cases, and that's very, very disappointing and very, very disruptive for people, because everybody's worked very hard in communities in their home to deal with this situation. We understand really how disruptive it's been. We also would want to mention going forward, there are rumours of further restrictions coming in for Warrington and possibly other surrounding areas. We have no information on that yet, but we've seen today in the northeast of England a series of restrictions have been brought in for that area, and we await further announcements very, very shortly as to what those additional restrictions may be for Warrington. So at this point, I'll hand over, please, to the Leader of the Council, Councillor Russ Bowden. Russ, thank you.
Thank you for that introduction, Stephen, and I'll start with a couple of thank yous, really. Firstly, thank you to everyone that's tuned in for this broadcast this evening. I think the numbers of people online just shows how important this issue is to people here in Warrington, and obviously, you know, people are keen to get the latest information and advice from the council. The second thank you is a really big thank you, I think, which is to everybody in Warrington. I think we look back over the course of the last 6 months and what the people of Warrington have been asked to do. Firstly, during lockdown, and as a result of national measures to deal with the COVID-19 crisis. But certainly, you know, recognising the impact that has had on the people of Warrington, and it really is a sincere thanks to everyone for the part that they've played in ensuring that up until now, the number of cases here in Warrington had been under a reasonable level of control. As Stephen's already mentioned, we moved over the last week or so into completely different territory. And what we've seen is a marked increase in the number of COVID-19 cases here in Warrington. And the number that people refer to is the number of new cases per 100,000 population over a 7-day period. And we've seen our situation go from a steady number around 10 cases per 100,000 to in excess of 100 as we are here today. And obviously what that means is that there are outbreaks of COVID here in Warrington. It is above the national sort of interest threshold, and it's inevitable that the attention of government and of the public health sector will start to focus on Warrington and more widely what's happened in the northwest. And that really was the reason for our advice starting on Monday regarding not mixing in your own home with people from other households. What our advice was really about was trying to stem the rate of increase of cases here in Warrington and look at what people themselves could do to hopefully avoid us moving into that kind of lockdown arena. And the news today shows obviously how quickly events can move, and we've got a number of council areas in the northeast of England which have today been placed onto increased restrictions with taking effect from tomorrow. And quite clearly our thinking was that we wanted to avoid that here in Warrington. What you have seen today in the North East is actually a number of measures attempting to restrain the rate of increases of cases there. And one of those is about not mixing with people from outside your household in your own home. So I think it demonstrates that we were thinking along the right lines back on Monday. And I think it also supports our evidence here in Warrington that actually the home is a significant place for the sharing of coronavirus, particularly for people who are going outside the home, going to work, indulging in their own leisure pastimes, for example, and then bringing it back to their homes. And of course, the home is effectively just like a large box, and the ability to spread the coronavirus between members of your household is obviously significant. I think a lot of people may question, why we chose that and not other measures. And obviously, we have to get the balance right here in Warrington. Tara Raj and her team in public health obviously look at the data. We knew exactly where cases were arising here in Warrington, and we obviously thought that was the most appropriate measure where people could actively support the work of the council in trying to stem the rate of increase. It's not to say that other measures wouldn't be effective, but of course we also know that having just restarted our local economy, particularly in the hospitality sector, then there was a lot at risk in terms of our local economy, but also in terms of security of jobs for people going forward. And that was a key part of the balancing equation for us. Obviously, if we don't manage to stem the rate of increase of cases here in Warrington, then that matter could be taken out of our hands. And I think we've seen that today with the announcement by the Secretary of State for Health, obviously in partnership with local leaders in the North East. But things will move very rapidly. And obviously there could be some enhanced restrictions in the days to come. What we do know in terms of the cases here in Warrington is that there's a strong link between people in their 20s and 30s and increasing cases. I think we primarily put that down to those people and going about their normal business in terms of going to work, but also obviously accessing hospitality as part of their leisure time. And that is a significant reason for the increase here in Warrington. We have seen incidents in settings where people from different households have come into close proximity, either in workplaces or elsewhere, but where they don't display any symptoms and yet they've unwittingly passed on the virus. And I think that's another key part of our thinking regarding mixing in homes. And of course, it's really important that where there are outbreaks, that information becomes known, that we have appropriate contact tracing, for example, if you go to a pub or a restaurant, but obviously the ability to pass it on and that to be undetected can create significant issues. And that's obviously a key part of the work that we do in public health to try and understand the context of increased cases and explain what's going on here in Warrington. So in terms of what we can still do, all of us, to remain safe, besides the advice that we've put out on Monday concerning mixing with other households, we obviously still have a lot of really strong and useful national guidance. And it's really important that everybody continues to follow that national guidance. And they are really simple things, good hygiene in terms of washing your hands often and thoroughly, using face coverings when you're out and about, not just necessarily in public buildings and spaces, but just going about your normal business. And crucially, one of the most important things is about good social distancing. I think we do see probably every day, all of us, examples where people aren't remaining socially distanced. And it's really important that we still do that in order to prevent the risk of transferring coronavirus between ourselves. Obviously, in terms of the offer, regarding, in terms of not mixing in households, it's really important that people continue to support those people within their wider network and through their support bubble. Households do rely upon each other, particularly where they have elderly or vulnerable people, and so it's really important that people continue to do that within their context. But we still have the rule of 6 proposed by government. It is really important that we don't meet socially in groups of more than 6 in line with that guidance. And it is really important that this big ask that we all work really hard not to risk taking coronavirus between households, that we don't visit other homes, whether that's indoors or in private gardens, either inside or outside of Warrington, unless you really need to in order to provide care and support to others. So I think that's what I wanted to say in terms of that message, Stephen. I'll pass back to you. Thank you.
Okay, Russ, thank you very much for that about drinking on the screen, but at least I'm drinking from the right cup. I'll now pass, please, to Tara, who will just explain from a public health point of view. So, Tara, thank you.
I'm aware that it feels quite doom and gloomy at the moment, and we must remember that happiness and emotional well-being is really important. So I don't want us to sort of lose sight of that. So how can we be happy and live with the situation that we are facing? I wanted to upfront just out the testing issue. We have, unfortunately, you've all heard the difficulties that people are having getting tests who live in Warrington, or your loved ones who live just outside. We are working really hard to support the national team who are responsible for the local offer. We do, we are concerned. We do need more tests in Warrington. However, one of the things that all of us can do is to make sure that unless you have those classic symptoms of coronavirus, it's better not to get tested, because actually, it's a little bit of a waste of time. There are particular people and particular types of professionals that need to get tested in order to do their job safely and to protect particularly vulnerable people. But unless you have symptoms, it's best not to take up that capacity. However, we are doing a lot of things to try and unpick that locally. I would say that if we're awaiting the national app that's going to be rolled out on the 24th of September, hopefully. That will be a date when we get our static mobile testing unit. I thought it was going to be the day after. It's going to be on the 24th, apparently. That still doesn't solve that problem of you having to log on and then be told to go to Telford or Blackburn or Deeside. So that hopefully is teething problems. I'm being very kind here, so let's hope that gets sorted. I'll pause. So can everyone see my camera is on? Yeah, okay. I just wanted to pause. You've probably already heard it several times, but the biggest way of stopping any kind of infection, and we are going into the flu season and other norovirus season, etc. It is the basics of washing your hands, washing them thoroughly. It's introducing it into your behaviours. And I have to tell myself this: it's hard to stop touching your face. I've got an itchy, I might have an itchy nose or something. So try to sort of think about how to incorporate that behaviours. Don't touch your nose, face and mouth if you can. It is really important to maintain that social distance. It's 2 meters really is a rule of thumb. It got reduced to 1 meter plus for probably practical reasons more than anything else. But the general rule of thumb is keep apart when you can, because that is going to be, along with the other measures, is going to be really, really helpful. Face coverings, some people actually are really, it's very difficult for them to use them because of health reasons. But if you are not one of those people, please do use a face covering when you can and when you can't keep socially distanced. It's really important. I'm just going to pause there and think about our, the settings that we love. For example, our schools and colleges, and we're about to welcome back university students to our campus. We're working very well and very closely with our schools. They're having to be infection prevention control specialists. That wasn't a job I think they signed up for, but we do know that our head teachers are extremely good at working with other infections. This, I think, is unprecedented, and we need to give them our support. They do have good risk assessments in place, and we're in touch with them as a council on a very frequent basis to provide support. It is a national issue, ensuring that our schools are COVID safe, and we are taking it very responsibly locally. And people are doing a brilliant job. The same goes for our care homes. This is a particularly a vulnerable issue. Those who have, we don't want to go back to where we were. We don't want to have the deaths and the misery that we saw. I don't accept that's acceptable. So we have to do everything we can. I'm not really keen to say you can't visit your loved one. If the care home does a risk assessment and on an individual basis, case by case basis, makes a joint decision that it's safe to do so, I'm reluctant to say no, you can't, because we know how important those sorts of interactions are at this time. So I feel that we have got an extremely good infection prevention control team in Warrington and the two boroughs that share our infection prevention control team. They've been working tirelessly with our care homes to make them as COVID safe as possible. But if you are visiting a care home and if you can't do it virtually, and we can support you if you can't do it virtually, if that's technology is an issue, we want you to come and ask us for some support. However, if you are taking up that very kind offer and that very important offer of visiting your loved ones, just think about what you've done in the last 14 days and then go ahead. So if you have been mixing, if you have been to a restaurant and you've been sitting in with a group of friends, then don't go to visit somebody in a care home, because you're likely to, if you've picked anything up, to spread, because it is another slightly bigger box that Russ alluded to, but it is still a box. So think responsibly, act responsibly, as I know people in Warrington do already. So it's doing more of what you do, not less. We do need to make sure that, in terms of visiting your neighbours, we're saying don't visit your neighbours unless you have to, unless you're providing support. But there's no reason why you can't check up on your neighbours. They don't even need to be vulnerable. It's just a nice thing to do. Some of the lessons of lockdown were how neighbourly people were, how many good social connections were made. So let's think about that in the way that you check up on your neighbour or a vulnerable person during severe weather conditions. Just make sure that they're safe. You can pick up the phone, maybe knock on the door, but just don't go in. That's what we're advising. Thank you.
Torika, thank you very much for that contribution. We'll now move to the question and answer part of this broadcast. So I thank people for submitting a large number of questions. Absolutely impossible to consider every question, but I'll take the first question, which I think is to me. This is from Ryan in Padgate. He asked me, what is the situation regarding COVID marshals? What enforcement powers does the council have to break up groups who are flouting the new guidance? I first say to you, Ryan, that we've had a really strong enabling relationship with the police over the last 5 months, and we've worked really closely together as a licensing authority, along with our colleagues in the police. On COVID marshals, I think none of us are very surprised by this announcement, and we're still trying to work out what the actual and realistic powers and duties and role of these COVID marshals will be, plus the fact we are still waiting to hear about how they will be funded. Having said that, we've been in conversation with Golden Square. There are people in Golden Square who are there to help people around the square. We're talking to Warrington Voluntary Action about possibly doing this through a voluntary role, and also talking to the Business Improvement District about the way in which we could make our town centre even more COVID secure. It would include, of course, the new market, which has got extremely high footfall. So we'll continue to work with businesses, shops and bars around the COVID marshal issue, and we'll continue to talk to government about their powers and their resourcing. I hope that answers your question, Ryan. I'll move now through from Padgate to culture, please. And many other people in culture have asked this question. Why are we asking people not to visit households, but also details from risks around other settings, e.g. pubs, bars and restaurants? I'll give that question please to Russ, please.
Okay, thank you, Stephen, and thank you to the residents who submitted this question. I did kind of expect a question like this, and I did try and cover it in my opening remarks. And obviously, the advice we gave on Monday was trying to take a balanced view to how we could most effectively try and limit the rate of increase of cases here in Warrington. And obviously, we also have to take into account livelihoods, jobs, etc. in that equation. And clearly, the council's powers are relatively restricted. And you know, if there had been measures proposed around shutting down hospitality venues, for example, the council wouldn't have been in a position to compensate those businesses, and obviously that could have had a long-term effect here in Warrington. And I think, you know, Tara talked about the importance of educational settings, for example. You know, it's vital that we get young people back into learning, both in terms of, you know, their own attainment, but obviously balancing their own development and sort of well-being into that equation as well. And so we thought that restrictions on households were something that was relatively simple to implement, that could be done on a voluntary basis, that residents of Warrington would understand the message that we were trying to give them, and it was something that was relatively simple for them to do, albeit accepting that it was a restriction on their liberty. And obviously, you know, people found through the whole lockdown in March and April that actually social interaction with their friends and family was really important to them. So it wasn't a decision that we took lightly. But clearly, every setting that people go into, where you've got the opportunity to mix with people from multiple different households, such as restaurants and bars or other public spaces, is a place where you're more likely to be exposed to the virus compared to staying in your own home. And so, you know, if people do have genuine concerns about going to pubs and restaurants, of course, it's perfectly within their gift not to frequent those kind of places. You know, if they're worried for themselves, or obviously worried about the impact that taking a case of coronavirus back into their own family could have. And again, I think that was covered by Tara in her opening statements, really. Just that, you know, if you're going to go and see elderly relatives or vulnerable people within your family or your friends as part of a support bubble or other activity, then obviously it's up to you to manage your risk as well. So, you know, you wouldn't really be sensible going to a restaurant or a bar and then going to see you know, an elderly relative in a care home the following day. You know, clearly people do need to, you know, think sensibly and obviously apply some logic and take some responsibility for what they're doing. In terms of, you know, going to public spaces like restaurants and bars, you know, obviously all of those venues should have proper arrangements in place. There should be measures to ensure appropriate social distancing, and they should have a contact tracing system in place. And so it's important that people do follow the COVID secure guidance for any venue that they go to, and particularly if you're asked to provide contact details, that you do so. And I think we've probably all heard the stories about Dominic Cummings has been into every pub in the country. Obviously for test and trace, you know, it's in your interest and the interest of your family that you provide that information, you know, truthfully and honestly, in order to play your part in what's going on. But everyone obviously needs to stay safe when they go out. We've got to acknowledge that there are local businesses and jobs that we're trying to support. And obviously having a strong local economy that gets through this COVID crisis, you know, offers a lot for our town. You know, it helps secure jobs, it helps secure our ongoing prosperity, but it also allows us to improve a lot of the inequalities that we see in our town and our society. And that's, you know, what we've been working to maintain throughout the pandemic, and obviously something which is a big national issue. And really, we have limited powers. Without a furlough scheme in place or funds to compensate businesses, we really can't feasibly shut down venues and stop people from visiting them. And that's why it really needs government intervention at that level. And that's obviously what we're trying to avoid with the advice that we issued on Monday. So at the current time, we think on balance, in the context of cases here in Warrington, that this was the appropriate step to take.
Thank you very much, Russ. If we move to another question now, this one probably for Farah. This question, I'm not certain who this is from, but what will be the rules for shielded and vulnerable people if case numbers continue to rise, Farah?
So my understanding is that the current guidelines and guidance is still in place. So there are no shielding and shielded legislation or guidance that we have in place today. I'm guessing that this is always under review. It always has been under review. It will continue to be under review. However, currently, if you're clinically extremely vulnerable, shielding has been paused and it hasn't been unpaused. So if you are able to work, you should. And if you are able to work from home or be redeployed, that is also you know, part of the workplace risk assessment. That hasn't changed. You know, people can still go outside. Just connecting up with the well-being factor. You need and also the maintaining of good infection prevention control. If you maintain good infection prevention control, keep your social distancing up, and you know, make sure you're trying not to allow people into your home unless they are providing support. I would say carry on as we are, and if any further announcements are made, we have if any further announcements are made nationally, we have got measures in place locally to stand up any requirements needed.
Okay, Tara, thank you very much for that response. Next question I think is aimed at myself. This is from Kaylee, Michelle and many others. Will this spike in cases in Warrington cause a major setback? Should we be worried about people losing their jobs and businesses going bust? A major concern that I've heard throughout the town. In response, I would say that Warrington is a very prosperous and thriving town from an inward investment and an employment point of view. So we started a high level of employment and an economic prosperity levels being the same. We've always done well to get people into work, keep people in work and support local businesses. I mean, indeed, in the last 5 months, the council's distributed £38 million worth of business support, business grants support to local businesses to help them through this rather challenging period. The furlough scheme we know comes to an end at the end of October, and we hope as many employers as well will come up with proper processes and procedures to deal with that challenge. We want to work really carefully with closely with our MPs, and we are doing, to make sure that they are recognising the need for appropriate economic recovery for the town. And we ask people to get involved in talking about business and talking to us about business, what can be done, and if you can, spend money locally in the town, because that helps greatly through this difficult situation we find ourselves in. So it's going to be challenging. By nature, I'm an optimist. I think by working together, particularly with businesses, we hope to come through this, and will come through this well. Thank you very much, Kaylee, Michelle and others. We'll move on to a question now for Russ from Mark, and again a few other people. What can be done to support health and wealth inequalities in the town? As we've seen nationally, there's been widespread agreement that inequalities gap has widened.
Yeah, thank you, Stephen, and thank you to Mark and others who raised that question. I think absolutely right. The evidence, nationally is about widening gaps in all sorts of inequalities, and that's a really important consideration for us as a council and a town moving forward. For example, just in terms of education, what we do know is that children from more deprived backgrounds have suffered more in terms of the closure of schools at the back end of the last school year, and that that gap could have continued without schools being able to reopen and bring children back into their educational settings. And obviously we've talked a lot around the economy, and actually having a robust and strong local economy that can offer people secure jobs and having safe places of work is a really important way in which we can manage that inequality gap. It is a really difficult balancing act. We are basing our responses on the evidence that we see, on the type of cases that we have of coronavirus, the settings where people are contracting the virus. And that's just good intelligence and data which is helping us to inform our decisions. And to be honest, I think as a council, one of our prime missions has always been around tackling inequality and bridging that gap between those who are more fortunate and those who are less fortunate. And we're under no illusions of the challenge that we face in order to support our economy, support our town and protect everybody's health and well-being. And I suppose that brings us back kind of full circle, because it demonstrates that we've all got a part to play currently. What's really important is that our local employers and businesses can continue to support their staff, and we all need to do what we can working together to keep people in jobs and to ensure that for people that do go into a workplace that they can do so safely. And that's driving all of our public health advice and guidance. And obviously, that's the important part of the announcement we made on Monday. Government support has been really, really important. As Stephen mentioned, the money that was provided by government, which has flowed through the council direct to businesses, and that's been absolutely crucial to keep businesses afloat. And we really do need this to continue. And obviously, in terms of the furlough scheme, it's currently timetabled to end at the end of October, and I'm seriously concerned about that and the implications of just simply stopping it overnight. I think we need a more creative approach, perhaps a greater tapering down of the amount of government support, with that gap being filled by employers in due course, because I think otherwise we just run the risk that people will move straight from furlough straight into redundancy, and that is not going to be good for our town, and it certainly isn't going to be good for our national economy. So I think we'll keep up the pressure on local government. We do need to work with our two MPs here in the town to ensure that those kind of arguments are made. And local authorities up and down the land, have the same responsibility, the same ask of government, really, which is to keep on supporting us and allow us to tackle some of those inequalities now before it's too late. And that there is, an even greater price really for this whole COVID-19 crisis.
Okay, Russ, thank you for that detailed response. This is a question from Mark. Last question, Tara, for you. This is from Scott in Appleton, and again, many others around the town. Why is it so difficult to get a test or get test results? And how is this going to be rectified? A national matter of discussion at the moment, one that's challenged me around my anger management levels this week. So how are we going to deal with that one, Tara?
Yeah, it's a bit like a photocopier. If it only had a little display with an arrow, you'd know where it was broken to be able to kick it. Unfortunately, we're not getting the answers to the questions. I don't really want to rehearse what I said earlier about testing. It is difficult. It's a national issue, and we have escalated it. I've escalated it, and Stephen has escalated it. We've escalated it as a council. We have had, and I have, myself and the team have supported local outbreaks. We've tried to get the capacity of the mobile testing units to help support that. We haven't been able to do that. We've been able to move the site, but when you go on the website, it still tells you to go to D side or somewhere else. So rather than try and fix the photocopier where we haven't got the manual, we're trying to work with our local hospital. So Warrington and Holton have a little huddle with our hospital and our clinical commissioning group to try and work out a small scale solution to help manage the outbreaks that we're seeing. We can't fix the wider problem of people in general not being able to get a test at this point, but we're hopeful of a solution, aren't we, Stephen? We're hopeful that national colleagues will come up with a solution that we can work with. I just wanted to say, people talk about local lockdowns. If we are going to hear something about a local lockdown, we don't necessarily have to use that as a story. It sounds like we've done something wrong as people in Warrington, and we need to be locked up. I don't see that. I see that what we have potentially are control measures to manage infection spread, to manage so that people like you and I don't get the virus, and if we do, that we don't pass it on. So if we think of them as additional control measures that we will get through, and if we think about how we get through together as Warrington together with our neighbours who don't live in Warrington, we will stand a better chance of keeping our jobs going, keeping people in schools and colleges and universities, and just keeping a bit of love in Warrington and beyond.
Okay, Zara, thank you very much. So can I thank you all for joining us at this tea time today. This has been a unique moment for the council, our first broadcast, and thanks to the hundreds of people who have given up your time to listen in. We'll evaluate and ask questions about ourselves about this, but we are intending to run another of these broadcasts early next week to make sure that everybody in Warrington is up to date from a local perspective as possible about the COVID situation. So can I thank you and good evening. Thank you.
Thank you.
Thanks, bye.